we are trying to address a problem which is called volumetric muscle loss. So volumetric muscle loss, or VML, results in a huge loss of muscle volume, and this is generally caused by traumatic injuries that can be faced by our military personnel as well as in the civilian population, and this results in a loss of volume of muscle, as well as a loss of associated other soft tissue like nerves and blood vessels. Everything gets damaged, and ultimately the patient might have to undergo amputation at the most severe case. So what we are trying to do in our research is come up with a tissue engineering strategy to replace this lost muscle volume, but not only the muscle volume, but also provide cues, chemical cues or cellular cues that can help in the neural integration and re-innervation of that region. Because if you don't have nerves connected with the muscle, then the muscle is no longer functional. So what we do is, and this actually fits in with this year's TERMIS theme, which is on bio-inspired technology-driven regenerative medicine. What we do is we take cues, we take design inspiration from biology itself, and skeletal muscles are hugely aligned structures. So what we do is we use synthetic polymer-based nanofiber sheets, which have aligned nanofibers on them. And then we culture motor neurons and skeletal myocytes on those nanofiber sheets. And once those are cultured, then these sheets, having pre-innervation, they are implanted in a rodent model of volumetric muscle loss. And we see the efficacy of these treatments and we have seen in some of our acute studies, which I presented this year, that having neurons in those implants significantly improves the endogenous muscle stem cell proliferation, as well as promotes vascularization within the injury site, which is also a huge criteria, and leads to maintenance of the surrounding neuromuscular junctions, which again, at a longer time point, is very critical to achieve functional recovery. So these have been promising results, which show that having neurons in an implant with preformed neuronal networks, actually helps in promoting and maintaining a mostly pro-regenerative environment within the skeletal muscle after this sort of traumatic injury. So this is very exciting, and we are looking forward to scaling up this technology and trying other more clinically relevant models, which I presented this year. So yeah, there's a lot to look forward to, but the initial results have been very promising.